I'd like to wish you all a very happy new year. And anyone else wants to join? So, wish you all a very happy new year, and let's start the session for another 6 to 8 weeks on this happy note. Guys, one of the problem which I faced also, and then in the subsequent years I saw that it's like the timing between the theory and the practical paper is a very big tension for all the candidates. One. Second thing is the uncertainty. Uncertainty means that whether my theory result will be okay or not, and shall I start preparing after my theory results comes out or not. This is a very big deterrent factor I'd like to tell you all. Last 4 or 5 sessions were good, but the previous session DNB gave a shocker that the day it declared the result, I think within a week they told that your practicals will be there, and hardly there was a time of 2 weeks left. मतलब the day the practical date was announced, वहाँ से लेकर के there were only 2 weeks of time left. So if who hasn't prepared at all, वो 2 हफ्ते में it becomes very problematic task for that person to go about it, है ना? So my since I'll say a humble submission to you all will be, please prepare for the exam as if you are going to give it. Positive thing attracts positive thing. आप negative सोचेंगे, negative things will come to your mind. आप positive सोचेंगे, positive चीजें आपके पास आएंगी. ठीक है? So let's go ahead with the first thing. This is the schematic of DNB which they gave for the last year's practical. है ना? So a few of you know me from before. I would like to tell about myself. I'm Dr. Shubhankar Tiwari. I passed out my DNB from Delhi, and during the DNB, when I was looking for these like how to go about the practicals, I found a big lacune for the practicals per se. Theory के लिए तो ठीक है, books and things were there, but for the OSCEs and all those things, there was a big lacune. So we started with this thing, and touchwood, God has been great. We are landing up into 7th session of this. We have a database of around 150 plus students as of now. So I would like to take you another 2-3 minutes how the DNB practical exams will go about. किसी को भी if anyone has audio or video disturbance, please like you can unmute and tell me, else you can drop a message or call on the group itself. Okay? So the first thing is you have total of 300 marks of OSCE. Total 300 marks of practical will be there. उसमें से आपको 150 marks के लिए करना है. My whole this thing will be that to push to people so that you cross 150 marks in your exam. उसके ऊपर it depends upon your hard work, it depends upon your residual knowledge, it depends upon your luck. Okay, so first thing that you see that the OSCEs are for 100 marks. Then there will be 2 clinical cases, 100 marks per se, and उसके बाद 40 marks का there is something ward rounds depending upon what kind of center do you get, what patients are there. Okay, and then there will be Viva of around in thick. Good evening, Dr. Kishan. So we were discussing about how these things go about here. So यहाँ पे there will be few points that you will keep in your mind while going for the OSCEs. There are 20 OSCEs of 5 marks each, which will result to your 100 marks. Now, important things about OSCEs are there is no negative marks. No negative marks. So you have to attempt all the OSCEs. Please don't leave any OSCE blank. आप blank छोड़ोगे तो फिर तो it is like you have not played that ball. You have to play it. Whatever you feel, whatever you think that this will be nearest to the right thing, whatever you can think of it, write it. Don't leave it blank. Second thing is OSCE is in parts. Parts मतलब every question will have A, B, C, D. Example की बात कर रहा हूँ, ठीक है? Like this is of 2 marks, this is of 1 mark, 1 mark, 1 mark. So if you answer everything in A, everything, you will get 2 marks. लेकिन अगर आपने B, C और D में कुछ नहीं लिखा, यहाँ पे कोई नंबर नहीं मिलेगा. Getting my point? So you have to attempt everything in order to get those marks out of it. So that is a very important thing. One. तीसरा चीज इसमें इंपॉर्टेंट है, फॉर एवरी क्वेश्चन यू विल बी गेटिंग 4 मिनट्स. एवरी क्वेश्चन यू विल बी गेटिंग 4 मिनट्स. तो जैसे ही आप क्वेश्चन, द मोमेंट यू स्टार्ट सीइंग द क्वेश्चन, द clock starts going like this, 3 minutes 59 seconds, and tuck 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 tuck, it goes backward. So this is the thing which creates the fear, which creates the apprehension in the mind, और जहां पे आप गलती करते हैं. So this is the place where you have to practice, practice and practice. Well, that's the only thing which will help you out on that day. Fourth point about OSCE is, as a normal human being, we have a tendency, suppose I am getting a question, and I remember 1 part, 2 part, okay, done. 3 I don't know, I leave it blank. Afterwards I will do it. But Dr. Saab, in DNB practical exam, you will not have any afterwards, because you will be getting 20 sheets like this. So this will be question number 1. You will be asked to mark it, your roll number and all. Question number 2, your roll number, center and all. Question number 3, इस तरीके से. तो जैसे ही आपका क्वेश्चन नंबर 1 का 4 मिनट गेट्स कंप्लीटेड, this whole sheet will be taken away by the examiner. Okay, and then your next question will start. Okay, so it's not that you will get that sheet back. It doesn't happen, my dear. Okay, so whatever you know, whatever you feel that this will be right, whether it's right or not, you have to finish it in that 4 minutes. Okay, so ऐसा कुछ नहीं है कि I'll do it later. Nothing is for later. You have to finish it in those 4 minutes. Okay, so these things are there. Then in the, okay, is anybody else having this problem of not seeing the screen? Okay, you can see now. Okay, thank you. Okay, so first thing. Second thing after this is, let me delete it. Coming to the cases. Okay, I'll be, for the next 6 to 8 weeks, I will keep on repeating that this COM's commerce is the king of all cases. 95 to 99% of you will get this COM's commerce. I'll be sharing around 20 pages PDF with you guys, and recent updates also, which contains around 100 odd questions. So wo aapko, you have to ratify it. You have to, someone else is there. Welcome, Dr. Meenakshi. Okay, so this COM's commerce, you have to ratify it. There is no embargo ki main chhod sakta hu. No, if you want to pass your exam, you have to go to the COM's commerce. This is the most important thing for all. After COM's commerce, second thing is your thyroid case. After thyroid case, you will have what kind of patients they have that day. Generally, tongue, buccal CA, all these things are may be given. And then, depending upon your luck, how unlucky you are, CA larynx, hypopharynx, these things can be there. But be assured, COM's commerce, most of you will get it. Okay? For coming for the short cases, you might have cases from the nose, that is your CRS with polyp, AFRS, all those type of things. If you are a little bit unlucky, you might land up in CA maxilla. Okay? Apart from that, PVC polyp, okay, GNA, if there, otherwise your salivary gland tumor. These are the possible cases that might be there. Okay, then comes your ward round and your table viva. Okay, so for this, the next 6 to 8 weeks that we are together until you go and pass your exam, I'll be repeatedly what all things you have to study for all those things. Okay, so for this, what I'll suggest is please revise your notes, whatever notes you have made. अगर notes नहीं बनाए हैं from wherever you have studied it directly from Scott Brown or from some study material, keep on revising it, because though the name is practical, it's all about theory. It's all about theory. है? And my job will be for you guys is, first thing is to push you so that you go for that beyond 150 marks. Uske upar it's up to you how much you go. Last time, one of our a person from our group scored 235 marks in the practicals. Okay, humongous, good, very good marks. Okay. So this is one thing. And second thing is, what are all the important questions? One, how to go about it. How to go about it. Okay. See, I've been going through all these things since last 3 years of my residency, then SR-ship, and then other 3 years. So, mota 6 7 years, I'm seeing all these questions and all. So, I'll be pushing you what all questions are expected to come, what all. Okay. So, I'll be pushing you what all questions are expected to come. Okay, and how we will go and manage the answers for that. Okay, so with this, this is a sample question. It's not that you have to learn about this, nothing. It's just that example how an OSCE will come in front of you. Okay, this is an image taken from one of the OSCE session. I think 2 or 3 sessions back this question was asked. As you guys can see, first thing is, here is the time. Okay, don't worry about what are the answers. Okay, you'll see these type of OSCEs innumerable number of times over the next 2 months. Okay, here is the time which start going backwards. Second problem which will come is, example, name the procedure which is shown in the picture. So you all know that this tarike ke questions you will be seeing in the thyroid sections, MEVAT and all. It's important section. Okay, but if you write many things in this question, this is only for 1 mark. This is only for 1 mark, 1 marks, 1 marks, 1 marks, or might be one of them will be of 2 marks. Yahan pe this section is not visible to you. Okay, so if you write multiple things on this thing, but you leave these 2 things empty, so you will not be assessed for this question. So that's what I want to push into your mind. I'll repeatedly keep on hammering it. Bhaiya, you don't have to leave anything behind. If you leave it, that is not a good thing. Okay, you have to answer all the questions. You have to write and answer all the questions. That is important. Whatever you feel. अब जैसे example की बात कर रहे हैं. Question number 3. Mention 2 neurological injuries specific. Okay, so suppose example you don't know anything, but my submission will be, if I will be attempting this answer and I don't know anything, so still I'll write RN injury or SLN injury. I'll not leave it blank. Okay, so with these all things, let us start with today's session. Okay, so today's thing I have kept on CA oral cavity purposefully because I will be repeating it again. I will be repeating these cases again. Serums commas at least 3 to 4 times, and remaining things will be repeated at least twice, if not thrice. Okay, because as the result comes out, we will have fresh intake of people. So I'll super fast feedback again. We'll revise it. So you people will get another chance to revise all these things. Okay, so let's go with this revision. How to supposedly if you get a patient of CA oral cavity for your main exam. Okay, so how you will go about it? Let's see this thing. Okay. For the next, bear up with me for the next 35 to 40 minutes, because I still believe that though I am on this side of the table, I still believe how a resident feels. You don't have that attention span more than 45-50 minutes. So I have had your 10 minutes of peaceful mind thinking. So 30-35 minutes, please give it to me. I'll make a schematic flowchart how to attempt your CA oral cavity case, along with what all Viva questions can be expected from this thing. One. Second thing is, I shared a video with you people around 50 minutes duration, 45 to 50 minutes duration. Please watch it at 1.5x speed for at least 2-3 times. You will be getting most of the questions from this PDF. That video is from the TMC Tata Memorial thing. So head and neck onco, if you read, your PG is covered. Your ENT, MS ENT, DNB ENT exam is covered. Everything is covered. You will be getting 20-30% extra in that. Once you complete that thing, I'll push in other videos which are important for you. चलो let's go ahead with this thing. ठीक है, like example, you'll have just a hypothetical case. ठीक है, you'll start with these things. Sir, this is a 45-year-old male, female, whatever you are answering, all these things are important. Why important? You will come to know in the next 30 minutes. Please stop me wherever you have any problem. ठीक है, please stop me wherever you have any problem. Again, I'm repeating it. ठीक है, because no one of us knows each other. That is the important thing, है ना? In our batch, the problem comes all those things ना कि like मुझे नहीं आता and all those type of things. These are like if you're not getting it, if you are not able to ask over here, drop a WhatsApp message to me after the class. I'll come back to you. है ना? Not an issue. But please ask it. है ना? What I want is you people should cross 150 marks in your practical exam. Sure. कि sir इतना year old male female came with presented with complaints of. So I have taken a sample of CA tongue, ठीक है, a growth over tongue. So I'll be taking the case over from this format only. You don't need to note anything. I'll share the PDF with you guys of this class also. Apart from that, schematic PDF of history taking है एक around 50-60 pages का, वो I'll share it with you. You can use it as per your convenience. One. Second thing is, whatever things you are reading, please keep it at one place. Example, C oral cavity आप आज पढ़ रहे हैं. All the questions keep on adding on this PDF itself, so that after 1 month, whenever you want to revise C oral cavity, you should not go back and again read what is given in STEL, what is given in Scott. इसी में आपने सब ऐड करके रखा हुआ है. You'll revise it in another 20-30 minutes, but maximum number of times. Okay. So without deviating now, next 30 minutes for C oral cavity. 40-year-old female came with complaints of. So generally we start with non-healing ulcer. Non-healing ulcer. यहाँ पे you can go as per your institutional protocol कि भैया आपको अगर if you want to go ahead with growth, that's up to you. But this is what we were taught. This is how I've been going ahead post my PG and SR-ship. Non-healing ulcer of itna duration, whatever duration you want to answer. For example, 6 months duration. And how you have to describe the non-healing ulcer? First, the location. Why is it important? You'll see in subsequent images. Then after location, the size of the ulcer. Like you have to answer, sir, initially the ulcer was 1 into 1 centimeter in size, which has progressed to the present size of 3 into 3 centimeter over the duration of 6 months. Okay, so you have described its size, you have described the growth. अब यहाँ पे आपको एग्जामिनर किसी भी समय रोक करके पूछ सकता है कि भैया ग्रोथ क्यों इंपॉर्टेंट है. लाइक एग्जांपल मैं खुद एग्जाम दे रहा हूँ, मेरे को द एग्जामिनर विल से डॉक्टर साहब स्टॉप, व्हाट इज द इंपॉर्टेंस ऑफ ग्रोथ. कैन समबडी ट्राई अनम्यूट एंड ट्राई टू आंसर. नहीं, चलो. Growth is important. कि जो the malignant cases, they generally tend to have a rapid growth as compared to the benign things. They have a indolent growth. Like they'll say that swelling is there for the past 10 years. So highly unlikely that will turn out to be malignant. But if a swelling is like a short duration, that ulcer is not healing. Okay, so all those things go in favor of being a malignant type of swelling. Okay, then you will associate whether there is pain with the swelling, pain with the ulcer or not, whether there is any bleeding associated with any ulcer or not, then any associated thing. What all associated things can be there? Whether there is any dysphagia. These all things relate to the functional things. Whether if there is any dysphonia, whether there is any cough, whether there is any hemoptysis, then whether there is any neck swelling or not. So doctor, why did you ask for neck swelling? Can somebody unmute and answer?
Sir, metastasis.
Neck node involvement.
Neck node involvement. Okay. So neck node involvement. Yes, metastasis is also second answer, but neck node is basically it's the spectrum of the same thing. Okay. So divide it and try to answer in a good format. Both are correct. ठीक है. So you will like जब आप थ्योरी पढ़ रहे थे, there is a very famous question from this section, management of N0 neck in oral cavity. है ना? This is a very famous long answer question since times immemorial. So in today's class I will like try to push it in front of you. Why is it important? Okay, just remind me by the end of the class. So you have to mention about the next study. So after you finish with the HOPI, for the long case, you have to take history in all the headings. सब कुछ आएगा. Past history, family history, treatment history, personal history, everything is gonna come. Long case में no shortcut. ठीक है? So after your HOPI, you have to tell about past history. So no history of simple complaint. Yeah. हाँ जी डॉक्टर साहब बताइए.
When we ask about history of excessive salivation also here?
You can put it. You can see what I preferred and how I advise it. Wherever you know the answer, वहाँ पे ही you have to put those things. Like example, if you put it, कि sir there is a history of excessive salivation, so the examiner is very he will be having that intuition to ask you only, doctor, why do you ask it? Getting my point? So if you are having that answer ready in your kitty, okay, sir, these are the reasons because of which I had asked it, so it's a very good go. But if you are having doubtful, if you are having doubt, please don't put it. Like example, आप COMS commerce में जाते हैं. COMS commerce आप जब भी शुरू करते हैं, I repeatedly tell people कि please don't utter the word tinnitus. Don't utter the word tinnitus. You will say tinnitus, he will ask you, and your Viva is gonna go in that direction of tinnitus, and you will get stuck. कि आप पढ़ के कुछ गए, tinnitus पूरा Viva उधर चला गया. तो ये हमेशा whatever you are knowing it, उसको ही आपके अपने you have to put it in your Viva scheme. Okay, so we'll be practicing these things. Great, good. Okay, so past history you have put, then you will put it your personal history. Okay, if there is history of smoking plus or minus, okay, then is there any history of alcohol? So here only they will ask you, Dr. Sir, is there any importance of smoking and alcohol in this history? So can somebody unmute and answer? What is the importance of smoking and alcohol?
So additive effects, sir. Like alcohol promotes the absorption of the carcinogens.
So the terminology which they will be looking is, you are right in your answer, that it has a synergistic action. The alcohol and the smoking both have a synergistic action if taken together. Okay. Apart from that, you have around 5 points that the alcohol, when it is metabolized in the body, it becomes acetaldehyde, which is again toxic. Okay. Then apart from that, it will be there because of the alcohol. There are multiple vitamin deficiencies. Then there is your cytochrome P450 inhibition is there. All these things, there are around 5 points. I've placed the PDF ahead of it. You go through it. Then for smoking, they'll ask you why is smoking important. So for smoking, please try to answer in pack years. Pack years is an important question. Even pack year is a individual OSCE question. Okay, so यहीं पे पहला वाइवा क्वेश्चन आता है. Doctor sir, what are the various pre-malignant lesions of oral cavity? Can somebody try?
Sir, leukoplakia, erythroplakia, oral submucous fibrosis.
Great. ठीक है, ल्यूकोप्लेकिया, एरिथ्रोप्लेकिया, एरिथ्रोल्यूकोप्लेकिया, ओरल सबम्यूकस फाइब्रोसिस. अभी at the end of the class we will be seeing what are the transformation rates into malignancy. In Scott Brown ल्यूकोप्लेकिया का दिया है, एरिथ्रोप्लेकिया का दिया है. I was not able to find about this OSMF, that इसका कितना conversion rate है. ठीक है, चलो let's go to the next point. You have to answer about family history. Okay, family history. Okay, sir, family history is not significant. Generally we say this thing, sir, family history not significant. Now, examiner again stops me. Why he will stop me? I'll tell you. Hey, Dr. Sir, you said family history is not significant. Do you know any cancers which are familial? Anything? Can somebody try? What are any familial cancers? Chalo, I'll write it. Yes. Medullary CA. ठीक है? The first thing is medullary CA. Medullary CA thyroid this is a very important MCQ to nahi, OSCE hai, very important OSCE from the thyroid section. We'll revise it again and again, but over here please remember it. Apart from this, there is something called as ataxia telangiectasia. These are basically not familiar syndromes basically. ठीक है, ataxia telangiectasia, there is something called as Bloom syndrome. Something is Fanconi anemia. All these things are familiar. Scott Brown mein hai, we'll be seeing it over there. Okay. Genetic, basically they all have a genetic predisposition. Genetic predisposition. Why it's important? Let's see over here only. Let's see it over here. Okay. So this is one of the famous question that Dr. Sahab, you said that patient is consuming tobacco for 20 years. Okay. So what if the patient stops using tobacco? So will the risk of cancer will still be there? तो वहां पे आपको आंसर यहां से देना है, this line से. So the risk of oral cavity is reduced by 30% in those who have discontinued it for so and so time. And as you take the name, कि sir Scott Brown mentions this data. जैसे आपने ये बोल दिया, like I'll say, अगर आप once or twice you quote your book / article, you have passed that 50% marks of your Viva. Believe me. Okay, if you answer in a confident way. So please remember this line from the Scott Brown. This will help you. Okay. Apart from this, this is what I was mentioning that time. Why this alcohol hazard? This is the synergistic word that you have to utter, and these are the 5-6 points which are important. Please go through it. That alcohol acts as a solvent. First point. Then your carcinogenic activity is there in alcohol also. Metabolite of alcohol is acetaldehyde, which itself is poisonous. Then it also inhibits the cytochrome P450. Alcohol decreases the activity of DNA repair and all those things. So please go through it. It is important. Please, again I'm repeating it. This will be there multiple number of times. Please revise it. But important question. And these are the diseases of which basically have genetic importance in your oral cavity malignancies. Okay, so over here one extra is there. Leaf Romani I did not write over there. Apart from this, Fanconi anemia, Bloom syndrome, and ataxia telangiectasia. Achha, second thing is please apne whatever, if you are traditional old fashioned, so make a notebook mein, otherwise apne pad mein. What are autosomal recessive that you are coming across? What are autosomal dominant you are coming across? There are around 15-20 syndromes which are important for us. Usme there is one very important stat question: is this autosomal recessive or dominant? So iska ek note bana karke chalna hai. At the end of the, like I'll say, 6 to 8 weeks mein, we will be comprehensively compiling it so that it becomes easier for you to remember. Okay, so over here, these are the levels of lymph nodes, easy, but you have to remember it. And these are the staging system. So please revise it. This is important. They will ask you what are the changes in the latest AJCC. Let's write it over here. Changes in latest AJCC. So you have to mention about depth of invasion. Okay, this is important. Please rattafy karna hai isko. You have to remember it. Okay, I'll not be going in details, but this table you should be thorough with. Okay, because there are multiple number of times. It depends how your examiner, in what kind of mood he is. If he is in a good mood, it's like you go sail through. Might be he'll start with this only. What is the staging of the oral cavity? And if you don't answer those things, so your Viva goes off for us. It's like I always give my example. We had, like जब ward rounds के लिए हम लोग ward rounds का था, ward round में there was a patient of total laryngectomy. So before going for the Viva, I was revising total laryngectomy, CL larynx, बिल्कुल revise पढ़ा भी हुआ था, and I revised it multiple number of times so that भैया good marks आएगा. And when I sat in front of the examiner, the first question he asked me, कि बता मेरे को staging of C hypopharynx, and I was like blank, zero. ठीक है, so that table I was like बिल्कुल demotivated कि fail हो जाऊंगा. So that's what I'm telling you. कि इस तरीके की staging please keep on revising. DNB में practicals are also, I'll say, horrific. Horrific is the word that I will use until you pass your exam. When you pass your exam, it's like easy. हाँ ठीक है, आसान है. जब तक पास नहीं होते हो, believe me, it is problematic. It is difficult. It is different from the MS practicals. ठीक है? In the coming weeks, I will tell you why it is different. But please keep on revising these things. Okay. So this is like what is the hallmarks of cancer. It is more of a theoretical thing, not to push much of it. Over here again, the syndromes are there, given twice in this chord round. So please revise it. If it is advisable, once you remember the names, please see the genes which are associated with it. This is again a question for you guys. Okay? Shall go ahead. Now, very favorite Viva question. What are the 5 S of oral cancer? Okay. So they will ask you, this is a traditional question. This is a traditionally questions. Old people are very fond of asking this thing. Answer this thing. Okay, sir, these are smoking, spirits, syphilis, spices, sharp tooth, septic. Like example, this question I was also asked in my Viva, like in our patient, this is a female. Okay? And female, and I gave the history that, sir, there is no history of smoking. Still your patient develop cancer. What can be the possible reasons? So यहाँ पे the possible reason में basically he is asking you what is the etiology of oral cavity cancer. So you like I took the Viva towards the sir, there will be sharp tooth, there will be history of using of excessive of alcohol, all those type of things. You can go ahead with it. Okay. Anything over here? Nothing. Okay, so this is again more of a theoretical thing. What are the importance of like what all things are there in your smoking? This is another Viva question. They'll ask you कि as soon as you say कि sir there is history of smoking या there is pack years, इतना pack years है, cigarette, बीड़ी, whatever you want to answer. They'll ask you what are the carcinogens present in the smoke, and if you say nicotine and then stop, तो फिर that is not a good thing. You should answer 3-4 things in one go. What all you have to answer, sir, there are polycyclic aromatic hydrocarbons, there are N-nitrosamine and aromatic amines, aldehydes, organic hydrocarbons and metals. इसके अलावा में आप additionals में you can add on like all the nicotines and all those things. So this is important. Please remember it. Okay. This is more for the theory thing. No need to remember. Okay. So this is repetition. What is the etiology? First of tobacco, then alcohol, then there will be infection, there will be nutritional factors, dental factors, genetic and immunological predisposition. So you remember in this 5 headings. Okay, please remember it. Okay, Kani's complex was asked once, so that's why I noted it over here. Apart from that, 2-3 things over here you have to remember. I'll just add it. Which type of cancer is associated with pipe smoking? Can somebody try?
Lower lip.
Yes. Okay, this is important. Please remember it. And then you'll be reading about lip. Please remember various named flaps of the lip. Lip recon. Okay, it's important. Please remember it. Okay. And then second thing is, name the cancer which is associated with reverse smoking. Again, someone. Yes. Heart. Yes, correct, doctor. Okay. So is there anyone who doesn't know what is reverse smoking? Because I did not know it until I saw people doing it. If someone is there, please let me know. I'll describe as we move on.
I don't know about reverse smoking. Please.
Okay, doctor. जैसे this is a cigarette normally, ना? ठीक है? This is a cigarette. We put this end in the mouth and we smoke it. So normally what happens is in some cigarette also, and like some kind of this THC charas also, what people do is when they smoke it till this place, only last end is remaining, they reverse it, like ये वाला end mouth में रखते हैं, and someone else will come and blow from this side. Getting my point? So this
Yes,
thing
sir.
goes into the mouth and someone comes and blows it in front of the mouth. So I read it. I did not get what was
Okay, sir.
happening, but once somewhere I saw people doing it, I was like, oh, ये क्या हो रहा है? ठीक है? So this cancer
Okay.
this is associated with your growth malignancies of hard palate. Please remember it. ठीक है?
Okay,
One,
sir.
two,
Thank
and
you.
third thing is welcome, doctor. And third thing is there's something uh, something called as this जो tobacco का the people in UP and Bihar, they make something called as khani. I don't know how many of you are aware of this term. There's something called as khani. They'll mix it with lime. These terms are given in your Scott Brown. Okay, so they mix it and they'll keep it in your gingivo-buccal sulcus. Okay, they'll put it over there. Okay, so this khani, lime, and this tobacco wala thing jo hai, this is associated with the malignancy of the GBS. So these three terms please remember from here, which are extra from the routine questions. Okay, so moving ahead. Now coming, after you describe all your family history and all those things, these are the 5-6 headings under which you will describe it. उसके बाद you'll have a short summary for summary for the history per se, and then you will come to the examination. ठीक है? So since we are taking it as a long case, so we will start with general conditions so and so, BP, pulse, SpO2, वो जो आप पूरा लिखते हैं, you have to write it. अच्छा, one condition over here only also. If you are writing BP 120/80, please look around in the ward if sphygmomanometer or BP apparatus is there or not. It should not happen you have not seen just कि भैया BP 120/80 लिख दिया and examiner asks you, डॉक्टर साहब BP कैसे लिया, where is the instrument, and you are like कि सर BP तो मतलब ऐसा मैं सोच के लिख दिया. This should not happen. If you don't see in the word, you don't use it, that's pretty okay, but you should not be caught कि भैया बिल्कुल fraudulent मार दिया. It shouldn't happen. Okay. In the general GC, you should use one of these two terms. One is ECOG and second is the brother of ECOG, that is Karnofsky. Sir, ECOG rating is 0 or ECOG rating is 1. So this I'll not say कि whatever you are using in your hospital, whether it is ECOG, whether it is Karnofsky, use that one. There is no sacrosanct यही use करना है. Like for us, we in our hospital used to had ECOG. So ECOG we are by heart, I remember it. But Karnofsky I had only remembered for the exam purpose. After exam happened, I forgot what is Karnofsky. So please remember, whatever you want, ECOG का short form is important question, or it's an important OSCE. They might ask you, what is the full form of ECOG? You should answer, sir, it is Eastern Cooperative Oncology Group, graded along like this: 0, 1, 2, 3, 4, and 5. Then they'll ask you why you are using ECOG and Karnofsky. Can somebody again unmute and answer for another 30 seconds? नहीं? Okay, so I'll answer. Sir, this is a type of performance scale. ठीक है? This is a type of performance scale कि भैया जब patient once he comes to us, what is his performance? Like it is 0. Sir, he is fully active. He is able to do everything. Now he is restricted. He is ambulatory. Still in 3, whatever he is able to do. 4th he is completely disabled. Because the treatment is intense. After the treatment, he might require chemotherapy, he might require radiotherapy. Now what is its functional status? So you have to compare कि पहले ECOG 1 था, अभी ECOG 2 है, 3 है. So you have to compare these things. Second thing is, it is a type of, I'll say again, medical legally also you have to document everything. What is the performance status of the patient that you are treating? This is the Karnofsky scale. Please remember whatever you want to remember, but एक आपको रट्टा होना चाहिए. Full form is compulsory. There is no movement over here. Now, second question will be, they will ask you what are the, when Viva proceeds, Doctor, very basic anatomy questions. What are the muscles of tongue? What is the nerve innervation of the tongue? I'm not going into details. Kept it written over here. You will have multiple articles on your net in your soft copy. Please go through it. Confusion, please get back to me. Now coming to, sir, they will ask you, Doctor, how will you manage this patient? How will you, like you say after examination, see, hold detail are not gone in this because I'll be taking these things again and again. This is more of a sensitization type of thing that how you are going to approach this thing. Okay, so don't get bogged down by the fact that I'm not dealt with it. Inspection में क्या point, what points you have to speak, in palpation what all points you have to speak. That all will be done. Don't worry about it. Okay, don't worry. I'm just dealing with the important questions that you should be aware about oral cavity. Okay. So in the CA tongue part, from Scotland, 2-3 things are there. See, first is this question that the conversion rate of malignancy of leukoplakia, this is 1 related 2.9. You will answer type of data like this, so it very good. So leukoplakia percent for erythroplasia it is 30-50%. Please remember it, it is important. It will help you in getting good marks in your Viva. OMSF, I was not able to find out neither I can play this. So coming for this thing, what are the important points that you should know from this thing? First is the lymphatic drainage for the lateral border of the tongue. This is an important point over here. And when it occurs bilateral, when it becomes bilateral, this is important. Okay. Now, second important point is this. I marked it over here so that you just bang up on the point. Sir, what is the most common way? So it is generally on the lateral of the tongue. Okay. Third type we already discussed. Not being asked, they'll ask you what is compartmental approach in CA tongue surgery. You have to answer this thing. This is adopted by the musculoskeletal oncology surgeons. Okay, one. Second thing is this is the conversion when you will go from monopolar to bipolar. Two. And third thing, this is again that which recall will you use for this thing. So this is a very common question. Yeah. What will you use for maxillary effect? Basically, when we study these things, these questions will come in your osteology part. Like when we'll be dealing with the mandible and maxilla, this question will come. I'll again tell you, doctor, this is the revision question for you. The mandible, which flap will be using, maxilla, which flap will be using. So here you have to read about in tongue, which flap will be using. Now, this is a very important question for the Viva. What are the indications for bilateral neck dissection? So just you have to enlarge over here, Scotland, they are beautifully mentioned. These are the levels, these are the things why you will go for bilateral neck dissection. So you have to just read about from here. Okay. There's no fun in repeating all these things. I'll tell you what are the important things. Please read it. You get confused or stuck somewhere, please get back to me. Okay. Now, I would like to mention about one of the very important papers which is there for the oral cavity. I'll take 4 minutes for this paper and I think 5 to 8 minutes extra after that. Okay. There's a paper by Dr. De Cruz et al. You must have read about it. It was a multicentric approach, and they divided the patient of oral cavity malignancy in 2 groups. In the first group, apart from the surgery to kiya hi kiya, SX stands for surgery. They did the wide local excision for the patient. Apart from that, they did elective neck dissection for the patient. And in the second group, they only did the surgery. They only did the wide local excision. Plus, they kept the patient under observation. Regular observation, regular scans. And as soon as the neck disease was there, the patient, and then he underwent neck dissection. There were 2 groups. So they found that this group, जिसमें elective neck dissection था, it had better prognosis as compared to this group. So they had to stop this disease, this thing in between, because they found that this is important prognostic factors are there for this, and it had a better result in the patients. The exact data I'll show you in this picture. Okay, this is important. Please, I'm sorry it has been very puchur, but please remember this. This is the data. Okay, this is the data over here. I'll share the exact article with you, but Scott Brown just mentions the small synopsis over here. Please read it. This is important. How will you manage N0 next? So there you have to take name of this paper, sir, as per Dr. De Cruz, as per Dr. De Cruz et al. I hope you might be able to see this red laser over here, De Cruz et al. And how they had divided it into in the elective surgery group and in the therapeutic surgery group, and what was the overall impression. My humble submission will be, please learn this data. There are very few articles which you should remember by heart. This is one of them. You take the names of this data, you utter the specific numbers, you will have a very good impact on the examiner, which will help you in attaining better marks as compared to your contemporary person. Okay, so for the next 6 to 8 weeks, not only I'll be helping you out with the how to go about things, but also how to answer in Viva. Okay, knowing something is important, but making the other person understand that bhaiya, you know that answer, that is an art. Few people are born with it, other people will have to learn that art for that Viva, because if you don't learn it, ऐसा नहीं है कि you will not pass, you will pass, but it is difficult, it is more difficult. So please practice these things. What all important factors are there where you have to put extra focus, please remember it. ठीक है?
Sir,
so apart from this,
sir.
हाँ जी बताइए.
Sir, what are the difference between this elective and like therapeutic, sir? Like dissection.
Okay. See, are you able to visualize these things? I'll again repeat this thing.
हाँ sir.
ठीक है. Like I have example, supposedly 100 patients है मेरे पास. ठीक है. I'm saying कि people who are already having neck nodes, they are having neck nodes, or whether they have it, whether they don't have it. I just go for the normal surgery. This is normal we do. Wide local excision we do for the ulcer or for that malignancy which we have. Apart from that, I will do this neck dissection for this patient. So this is the elective group. Okay? For the other group, if they don't have neck nodes, they are not having neck nodes, so I am not offering a radical surgery for them. I'll just say, okay, you undergo wide local excision because this is the traditional norm. This was the traditional norm. ये तो change हो गया. After this article only this thing changed. Whether you have N0 neck, you have to undergo neck dissection. Beforehand, what used to happen was people just underwent केवल surgery. Neck dissection नहीं होता था unless and until the person had neck nodes positive. Okay, so यहाँ पे neck nodes positive नहीं है. You are having N0 neck. Okay, so you will go only wide local excision and regular observation scan. As soon as any neck node positivity or METs is detected, then neck dissection was done.
Okay, sir.
So getting the difference between both the groups. So this is what you have to occur. So this is normal how you understand, and इस पे आपको ये numbers याद करना है. From your book, this is, I know it is very dirty over here, but this is dirty because you understand it's very important. I have been marking it n number of times for n number of batches. Please remember it. You again get confused, please come back to me. Again, no issues, no embargo in that. This is very important. You should not forget it. This table. Okay. So after this, another Viva question will be, अच्छा डॉक्टर साहब सर्जरी आपने कर दी, सर्जरी के बाद anything you have for the patient? Sir, patient can be given radiotherapy. So the next question comes, how you will give him radiotherapy? So these all details of radiotherapy we'll discuss when we'll go for the radiation section. Brachytherapy से लेकर के IGRT, IMRT, all those things we'll discuss in those things. Here, the important question that you should remember is, what are the indications for post-operative radiotherapy? Okay, so this PORT stands for the post-operative radiotherapy. There are 4 indications. Please rectify over here. First is it should have positive margins. I know you would have remembered it, but please remember it point wise. आप point wise याद करते हैं, it remains in your mind for a longer period. If you just rectify it, भूल जाओगे. Second is your multiple cervical lymph nodes. Third is your extracapsular spread. Fourth is stage 3 and 4. This is along with perineural spread and thickness more than 9 to 10 millimeter. This is important. Okay, so let us close this thing. Okay, यहाँ पे 2 more questions, please remember it. First is, what are types of glossectomy? You would have read it for theory. Please revise it. I'll be sharing the PDF of this glossectomy. Flaps and their recon. This is important. Okay, this we will discuss. Then third question is your types of neck dissection. I know this sounds as a very simple question, but believe me, once you answer in Viva, that is very important to mention. Ki, bhaiya, what if difference between RND and MRND? Okay, they will ask you what structures you remove in MRND. This is important. This is important. Okay, please revise it. Now, one more very important thing. Since we have started it for the first time, so I'm just telling the answer of this question. There's something called as field cancerization. Okay? This hypothesis was given by Slaughter et al. So also known as Slaughter hypothesis. Please remember it. This can be asked to you. What is field cancerization? Multiple places. यहाँ पे पूछ सकते हैं. CA larynx में आएगा, bronchoscopy वाले region में. All those things. Wherever smoke is involved, they might ask this question. Okay. In simple language, I'll just tell you. Like in a field where people are playing football, the football goes to every nook and corner of the field. So that whole football is exposed. To all the areas. Similarly, when a person smokes, not only his oral cavity is in the contact with the smoke, or his entire aerodigestive tract is in contact with the smoke. So that leads to multiple plethora of problem. This is the just gist of whatever things are there. People who like to dwell in further, please go through this article, or multiple things are available on net. This was the simplest one which I could find. But just remember this thing, what is field cancerization? Who gave it? These two things are important. I'll keep on repeating it multiple number of times. Please don't forget it. Okay. Please bear up with me for another 5 minutes. Okay. This is another one more important question. What are indications of neck dissection in CA tongue? I'll just enlarge it over here. Okay. Nothing much. Sir, there are 3-4 indications. Okay. So that you have to remember. Just this is रट्टा वाला part. Already port पीछे देखा हुआ है हमने. We already saw it. Port. Then indications of radiotherapy in CA tongue. Similarly, the same thing you have to answer. Okay, there's something called as visor approach. Okay, visor approach in surgery of CA tongue. Please read this paragraph. Okay, and these cuts I'll not mention over here, but this is important when we will osteotomy. Cuts in rhinoplasty में भी important है, maxillectomy में भी important है. Both the places it's important. ठीक है, even in maxillectomy they have asked it. We'll share the OSCEs with you. कि what are the osteotomy cuts for total maxillectomy? Okay, so you have to mention sequence wise. It's important. Okay, 2 हो गया, and even for the mandible also. ठीक है, this is already mentioned. ठीक है. Okay, muscles of tongue, another question. Answer is given over here. Please go through it. This is important. Okay. Now, one thing over here, genioglossus. This is called as safety muscle of tongue. Why I have wrote this thing, you will see in the subsequent images which are coming in front of over here. Now, the next 2 pages, these are the Viva questions which I have taken from this TMC wala video wala Viva. That video I have shared with you guys. These are the questions from that. What all imagings you are gonna use. Okay, so you have to answer both about CT and MRI, and you have to describe it in 3 heads. First, what extent you will be taking, why neck and distant mets. Why is CE MRI important? It gives a better head for perineural invasion, DOI, local invasion. But one thing I would like to If you get stuck somewhere, okay, not only for the C oral cavity, in any of the discussions you get stuck somewhere, whether CT or whether MRI, okay, so you can answer as, sir, this is our institutional protocol. Like example, where I did my DNB, for all oral cavity cancer, we just used to do CT, ठीक है, MR नहीं कर रहे थे, ठीक है. Normally it happens कि lateral border of tongue, buccal mucosa, we do the norm is to do MRI, okay. But the answer for us for Viva was, sir, this is our institutional protocol that for all these things we are doing it, okay. So whether if you get stuck somewhere, the answer should be, sir, this is our institutional protocol. Okay. But this is not that everywhere you use it. If you get stuck somewhere, okay, this is an important question. What's the difference between thickness and DOI, depth of invasion? Please read it. Then, okay, this is not much of it. Okay, anything else remaining? Thickness हो गया. Okay, this is another question. When you will do tracheostomy before, when involvement of genoglasses is too much, when extensive resection is tracheostomy is a must. What are the indications for examination under anesthesia? Okay, so all these are Viva questions which I have seen from multiple videos and Viva from the head and neck oncology for ENT as well as surgery, both of them. So those I have accumulated. For OSCE purposes, these images will be important. Go through them. These images I have taken from KenHub. Okay, they might normally genoglossus is the most important one. But DNB being DNB, they might ask you anything. Okay, so they might like example for this thing, they will put a mark somewhere to identify what is the muscle. Okay, like example, if they ask this is genoglossus, okay, identify X, identify Y, which is the safety muscle of the tongue. So those things you have to remember. यहाँ पे one question will come, what is the nerve supply of the following muscle? Please remember it, because if you start remembering in the exam, where you have to write vagus and where you have to like lingual, confusion will gonna come in those 4 minutes. So please remember those things. Okay, so these are the another two muscle genoglossus. Another view is there. This is for the hyoglossus. Hyoglossus is also important. Okay, hyoglossus is also important, and there's 2 more, palatoglossus. Come up and over here. This is your styloglossus. These are the 4-5 muscles over there. Okay. So in the examination scheme, when you will start examining you have to mention about oral cavity, because our case is of oral cavity. So यहाँ पे everything you have to write: inspection, palpation, everything. Not percussion and auscultation. Don't come over here. यहाँ पे आपको you have to stop. Then about the oropharynx. This you have to mention in your exam. Then ideal findings, this you have to mention 4. And please don't rest your case without mentioning the neck. Okay? So examination of neck is very important. Whether you find anything, you don't find anything, at least utter this word, sir, on examination of neck, this is there. If you just jump upon oral cavity karke, you come to your, sir, this is my diagnosis, so फिर थोड़ा सा examiner will get stuck. Whenever examiner asks you, Doctor, you are told this is the patient, how will you manage him? Don't jump upon surgery. Whenever examiner asks you, how will you manage? First question will be, sir, I would like to evaluate the patient further. Not only here, example in CM's commerce. आपने पूरा वाइवा दिया, examiner asks you, Doctor, how will you manage? You just jump upon this, sir, I will do canal wall down for the patient. You answer this thing, you will not get good marks in viva. But a person who says, sir, I will like to evaluate the patient further, he gets good marks. And stop and wait for the examiner. He'll ask you, Acha, how will you evaluate? So go ahead. Sir, I'll do PTA, then I'll do X-ray method, I'll do HRCT temporal bone, step by step. And if you know the answer beforehand, it's always better. Tak 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 karke you put it in. Examiner generally tends to give better marks to a person who answers in points. Answers in points about the important thing is is a differentiating factor. Okay, so all these things I'll not mix it over here today. So this was the, I'll say, first thing only, first class. So we will go as per schedule and we'll modify it as per the requirements which come ahead for you and as well as myself. Okay, so this is and second thing is from tomorrow you will start receiving the important questions that had been told in the flyer as per se. What all questions will be expected from you. Though they will constitute of the important tables, diagrams, and Viva question from you, Scott Brown as well as Lalwani and other books. One. Second thing, from important articles. Third thing, previous year questions. So from these things only we'll keep getting jumbled up things karke another 6 to 8 months definitely for every time. Around 9 o'clock daily, try to generally phone everyone keeps with them only every time. Around 9 o'clock, please keep on looking another 5-10 minutes and push all the questions that are important for you. Revise it once while going before to sleep, and once you get up in the morning, please revise it. Twice a revision of one topic, I don't think you'll forget it. It's not that difficult. Okay, and I'll be available on you for on call, WhatsApp, whatever you feel like. That's okay for me. Anywhere you get stuck, any problem for till your exam happens, I'm there for you. And let me tell you that the previous batch, they have around 80-100 people in a group. Till date, people have not, they get stuck somewhere. They are not getting their provisional certificate, they are not getting their degree, not any problem. So basically, you have that closed community where people help out, and it's important because there's no much senior type of person over here. Okay, so nobody is gonna judge you. कि भैया तुम गलत बोल रहे हो, सही बोल रहे हो. It's okay. It's like a helpful community. Please help each other. And the more you practice, the more you discuss, the more you help each other, the more you help out yourself also. So if any point from your side, anyone, generally no one speaks, but still if anyone is there, please free to yeah. Okay, so if anything is there, if you don't want to speak up, you can drop a message also. Any inputs from your side, we'll try to incorporate it. And if there's nothing, we'll call it a day. Please revise it. I'll share the PDF with you guys, and we'll meet on the next scheduled date with the next class. And from tomorrow, we'll add the have discussed things. Chalo, bye guys. Take care. Good night.